Newborns can do some strange things that look scary, especially when you're a new parent. In this video, I'm going to gently walk you through 10 newborn behaviors that often look worrying, but are actually completely normal in most babies. This is Calm Baby A.I, helping new parents feel safe, confident, and supported. Behavior number 1, shaky or jerky movements. You might notice your baby's arms or legs shake, twitch, or jerk suddenly. This usually happens because their nervous system is still developing. It is very common to see a bit of trembling when they're crying, excited, or falling asleep. You only need to worry if the shaking is constant, doesn't stop when you gently hold the limb, or if your baby seems unresponsive. But for most newborns, these movements are completely normal. Behavior number 2, noisy breathing. Newborns breathe loudly. They snort, grunt, whistle, and make all kinds of unexpected noises, especially during sleep. Their airways are tiny, so air moving through them can sound much noisier than you'd expect. It's usually normal as long as your baby is feeding well. Their color looks healthy, and they settle between feeds. You should only be concerned if your baby is breathing very fast, sucking in around the ribs, or turning blue around the lips. Behavior number 3, hiccups. Newborns get hiccups a lot. Their diaphragm is still immature, and even small movements after feeding can trigger hiccups. They might look uncomfortable, but most babies are not bothered by them at all. Hiccups are almost always normal, even when they happen multiple times a day. You should only be concerned if hiccups always come with vomiting, or if your baby seems distressed every time they happen. Behavior number 4, grunting in sleep. Many newborns grunt, strain, and make effort noises in their sleep or when they're trying to pass gas or poo. Their digestive system is still learning how to move things along, so they use their whole body as they figure it out. It's normal to hear grunting as long as they settle, feed well, and breathe comfortably. Grunting with difficulty breathing, flaring nostrils, or a blue tongue is not normal and needs medical attention. Behavior number 5, crossing eyes. It can be really worrying to see your baby's eyes cross or drift outwards. In the first couple of months, their eye muscles are still learning to work together. Occasional eye crossing, especially when they're tired or focusing on something close, is completely normal. If one eye is constantly turned in or out after a few months, that's something to mention to a healthcare professional. Behavior number 6, the startle reflex. You might see your baby suddenly throw out their arms and open their hands as if they are falling. This is called the Moro reflex, and it is completely normal in newborns. It often happens with loud sounds, sudden movements, or even just when you gently place your baby down in their crib. This reflex usually fades on its own by around 3 to 6 months. Behavior number 7, a shaky chin or quivering lip. A trembling chin or a wobbling lower lip can look like your baby is freezing or frightened. Most of the time, it's simply their nervous system still developing, especially when they're crying or trying to feed. It's usually normal unless it happens constantly when your baby is calm or if it's paired with other unusual symptoms. Behavior number 8, flaky or peeling skin. Newborn skin often peels on the hands, feet, or body during the first couple of weeks. This is simply your baby shedding the outer layer of skin they had while in the womb. Baby-safe moisturizer can help if the skin seems dry, but most of the time it improves all on its own. If you see red, cracked, oozing, or very irritated patches, speak to a professional. Behavior number 9, sneezing. Newborns sneeze a lot. Their noses are tiny, and sneezing is how they clear dust, milk, and mucus. Frequent sneezing on its own is completely normal. It only becomes a concern if it's paired with a fever, poor feeding, or heavy congestion that doesn't improve. Behavior number 10, strange sleep noises. Newborn sleep is noisy and active. They grunt, sigh, whine, twitch, and even smile or frown in their sleep. This happens because newborns spend a lot of time in light sleep, where their brain and body are very active. It's normal unless your baby is struggling to breathe, going very floppy, or turning blue. The early weeks with a newborn can feel overwhelming, and it's easy to worry about every little sound or movement. But most of the behaviors you're seeing are simply signs that your baby is growing, adapting, and learning how to live in the outside world. You are doing better than you think. If you have a newborn behavior you want explained, leave a comment. I make videos based on your questions.